Chapter 44, The Child with GU Alteration. Please refer to the review of the GU system and common labs and diagnostic tests for GU disorders at the beginning of the chapter as needed for a reference. Also, read the boxes throughout the chapter. Enuresis is having difficulty in urinary control. Nocturnal enuresis occurs during sleep at night, and diurnal is during the day. Manifestations for nocturnal are history of bedwetting. They do not awaken to void. It's not concerning until the child is over 6 years old or has low self-esteem. Diurnal manifestations include urgency, frequency, and inappropriate wetting during the day. Diagnosis is made by symptoms and ruling out UTI and also for underlying diabetes. Also, the urine should be checked for excessive calcium levels and a pinworm evaluation as well. An ultrasound of the bladder may be performed. Therapeutic management includes watching fluid intake after dinner, having the child void right before bed, and avoiding extra sugar and caffeine after 4 p.m. Behavioral conditioning can be successful for some children, but many times can take 6 months before results are achieved. Desmopressin acetate, or DDAVP, is a tablet given at night that has been helpful to some, but should not be used in children less than 6 years old. Urinary tract infections should be familiar to you. This book also puts hydronephrosis and vesicoureteral reflux within types of urinary tract infections. Manifestations of a UTI can vary with age. Box 44.1 breaks down the symptoms by age. It's harder to detect in an infant since they cannot tell you what is happening. Fever or hypothermia can be signs in the infant. A UA is typically done on any infant with a fever or hypothermia with an unknown origin. Children may complain of suprapubic pain and may notice an increase in frequency or urgency. Diagnosis is made by a UA and the symptoms. A urine culture can determine the causative factors and guide treatment measures. Hydronephrosis is swelling of one or both kidneys. Kidney swelling happens when urine can't drain from the kidney and builds up in the kidney as a result. This can occur from a blockage in ureters or from an anatomical defect that doesn't allow urine to drain properly. Manifestations can include back or flank pain, urgency or frequency of urination, nausea and vomiting, and failure to thrive in the infants. Diagnosis will include your UA, a CBC, kidney function test, ultrasound, and avoiding cystourethrogram, an X-ray exam that uses a special dye to outline the kidneys, ureters, and bladder and urethra, and they will capture images before and during urination. Vesicoureteral reflux happens when urine flows backward through the ureter from the bladder up into the kidney. Normally, the urine flows only one way in the ureter. Urine flowing the wrong way makes it difficult for the kidney to empty properly and causes the kidney to swell. Antibiotics are the treatment choice for each of the urinary tract infections. The route and how long is determined on the severity. Nursing care should include the importance of finishing all medications, proper wiping to avoid infections, and proper hydration. Surgical repair may be needed in the VUR, but many times the child will outgrow it without surgical interventions needed. Cryptorchidism is when the testes are hidden or do not descend. It can either be unilateral or bilateral. Manifestations include the testes that are not palpable or easily guided into the scrotum. If they cannot be found, they will rule out if they are truly absent. Therapeutic treatment includes just observing for the first 6 months. Surgical intervention to bring the testes down may be done after 6 months of age. It is typically done outpatient and by a laparoscopic approach. Hypospadias is a congenital deformity where the opening of the erythromeatus is below the normal placement of the glands of the penis. Epispadias is where the opening is on the dorsal aspect of the penis and is more rare than hypospadias. Manifestations include the abnormal placement of the opening, and diagnosis is made by the physical assessment. Correction of hypospadias is done surgically as an outpatient status. Recommendation is to perform the surgery when the child is between 6 and 12 months old. They should not be circumcised. After surgery, the child may have a stent placed or a urinary catheter while things heal. Activity restrictions need to be followed for a few days after surgery. Surgical repair for an epispadias is more complex and many times includes the bladder, urethra, and they may need to lengthen the penis. Hydrocele is a painless swelling of the scrotum and is a result of a collection of fluid. The majority of the time they will resolve on their own by 12 months of age. One that is not resolved by 12 to 18 months or one that is tense should be referred to have it surgically repaired. Testicular torsion is when the rotation of the testicle occurs, which stops the blood flow to the area. If not corrected immediately, it can cause irreversible damage. Manifestations include sudden onset of severe pain that progressively goes to the scrotum and can include edema and erythema. It's more common in the adolescents than the younger children. This is considered a surgical emergency and it needs to be dealt with quickly. If the affected testicle is necrotic, then they will remove it.